All right, so what can we learn from NFL prospects and draft picks to help us better manage your concussions? Well, what we're finding is that we might be able to look at different biomarkers in your blood before the season to help prevent damage later. I'm Dr. Mark Heisig. I'm a concussion specialist. We're going to look at a paper where we found several markers of cell membrane health, inflammation, and nutrient status that can actually help us optimize your nutrition and supplementation to keep your brain and performance in tip-top shape. So we're going to look at different markers of, again, inflammation, cell membrane health, and nutrient status that we found in NFL prospects. And what we found is that these NFL prospects often have way more than one deficiency or one variant in these biomarkers. It turns out that actually 1 in 3 of these prospects, so like every third football player you saw, had at least 3 variants, and 50% of the football players had 5 variants when you're looking at like optimal functional ranges of these labs. What were we looking at? We were looking at markers of inflammation. So we were looking at the omega-3 index, and when you break that down, we were looking at the arachidonic acid to EPA ratio. We were also looking at homocysteine. From a nutritional status, we were looking at red blood cell magnesium and vitamin D. Why was I blanking on that? So the omega-3 index, what that tells us is it tells us how much of your red blood cells as a percentage are made up of the anti-inflammatory omega-3s. Having a higher omega-3 index, somewhere between 8 and 11%, is beneficial for cardiovascular health and neurological health. A lower omega-3 index, we're talking 4 or less, really anything less than 8, but kind of 4 or less, is associated with lower cognitive flexibility, lower mood, worse executive function, worse neurological and cardiovascular health. Well, in these NFL prospects, the average was actually 4.66. Remember, we want that to be greater than 8, somewhere between 8 and 11. When we look at the arachidonic to EPA ratio, this tells us the ratio between your inflammatory omega-6 fats, so the arachidonic acid, and the anti-inflammatory omega-3 fats, EPA, or eicosapentaenoic acid. A higher ratio points towards more inflammation. We ideally want this ratio less than 5, optimally less than 3, and the average among these NFL prospects was 29. So when you look at the omega-3 index and the arachidonic acid to EPA ratio, we're looking at inflamed athletes. We're looking at cell membranes that have a lot of pro-inflammatory fats within them. So when we look at another marker of inflammation, homocysteine, this is a marker of inflammation particularly regarding your cardiovascular and your neurological systems. Elevated homocysteine is associated with cardiovascular diseases like stroke, and higher levels of homocysteine after TBI, like severe TBI, are actually associated with greater mortality outcomes, so more death. We want this marker to be less than 11, optimally less than 9. And what we find is up to 47% of athletes at large actually have elevated homocysteine levels. The average among these NFL prospects was 11.4%. So remember, we want that less than 11, optimally less than 9. When we move into nutritional status, what we see is red blood cell magnesium. Magnesium is needed for more than 300 different enzymatic processes in your body. It is critical to maintaining heart rhythm, muscular function, blood pressure, immune system function, glucose levels, calcium absorption, and a whole bunch of other stuff. For you to actually biologically use ATP, your energy molecule, magnesium has to be complexed to it, and magnesium is used for energy production. So this is huge for athletes, and it's possibly a player in excitotoxicity after concussion, more magnesium, less excitotoxicity. And so this marker is less stringently defined, but we want it somewhere between 4.5 and 6.5, ideally 5.5 to 6.5, and the average among these prospects was 4.1. So we're looking at a mild magnesium deficiency, inflamed cell membranes, and inflammation through homocysteine. And so now we're moving on to vitamin D, and vitamin D is used everywhere in the body. It helps regulate nerve cell death, neuroinflammation, oxidative damage, excitotoxicity, nerve cell membrane repair. It plays a significant role in neuroplasticity. Within exercise performance, it actually helps regulate hundreds of different processes, including exercise-induced inflammation, neurological function, cardiovascular health, glucose metabolism, bone health, skeletal muscle performance, including your strength and your power. And so ultimately we want vitamin D at a minimum, we want it above 30, closer to 40 to 60, maybe even 60 to 80, and the average among these prospects was 30. So they're just riding the line of 30. All right, so that was a lot. What does this tell us? What this tells us is that possibly, maybe even especially, elite athletes are inflamed and a risk of some nutrient deficiencies that are critical to their athletic performance, their neurological performance, their cardiovascular health, their overall kind of health and well-being. And the fact of the matter is, as an athlete, you're going to go through practices, you're going to go through games, and the risk of injury is there. And so ideally having not only your joints and your muscles and your conditioning in preparation for kind of the grueling task of a season, but also having your metabolism on board, having lower and appropriate inflammatory markers, having appropriate nutritional statuses, so that if or when an injury occurs, you're prepared. Your body is prepared to go through that in the fastest, kind of healthiest recovery time possible. All right, so if you learned something new or you found this helpful, go ahead and give this a like, share it, save it, do whatever you do with videos. I appreciate you for watching.